Wisconsin's Department of Health Services has asked the governor to create a drug testing program in the FoodShare benefit program. I'm Bryn McBride of ABC for Health. We're talking about a request that was made last week to Governor Walker by the Department of Health Services, asking that individuals that participate in the job training program, that FSET program, FoodShare Employment Training Program, be required to take a drug screening test to be eligible to get their FoodShare benefits. Now, this would be able-bodied adults without dependent children. So adults that are determined able-bodied, so they don't meet disability requirements, and they do not have children in the home, and they are participating in the employment program. That category of adult is the one that they want to drug test. The rationale in the letter written to the governor was to create a stronger workforce and fight the growing opioid epidemic. Now, the governor and legislature said that they will review the request and publish their findings and the results in the administrative register, and they indicated this would be a pretty smooth and fast process. Now, whether the feds need to approve such a request, a waiver request, and this would be Department of Agriculture, the ones that oversee the FoodShare program, whether that would be something that needs federal approval is a question mark. It is something that appears to have needed federal approval in the past, but it's not clear if the state of Wisconsin has gotten some sort of waiver of that approval requirement or that step, or if they're just skipping it altogether. Now, as you can imagine, there are many concerns that have been raised about adding hoops and hurdles in the path of getting to food security for many families. Now, the impacts that people are speaking of is that food security is indeed a pathway to work, not necessarily the other way around, keeping someone from participating in the work program because of this drug test and getting food security and then becoming a better contributor to society following their own logic is something that seems very muddy and backwards in the way that it was proposed in this request. Now, we have seen hoops and hurdles added to the FoodShare program as of late. You don't have to look that far back to see the work requirement itself that was added to the FoodShare program. And while 20,000 people did join the FoodShare program by finding jobs, we lost 64,000 people off of the FoodShare program because of that one requirement. The estimate of how many people would drop off of the FoodShare program because of the drug test requirement is not yet known. We do know from other states that have tried to do drug testing in some of their public benefits programs that it has not gone well. The state of Florida is the most commonly referenced example, where it actually cost so much more and added so much more administration that it was not a viable effort. They found very few people were using drugs at all to warrant any of the cost of administering this very expensive program. Now, public hearings were held several months ago when this idea was first proposed. The opponents to drug testing in the FoodShare program included individuals that processed FoodShare applications, saying that they did not have the staff, they did not have the time, and they didn't have the budget to add this extra hoop and hurdle and requirement onto the FoodShare application. Advocates for those that are very low income also spoke up and said this is not a way to get people back to work, and it is not a way of getting people food security. It is indeed the opposite. Now, whether federal approval is needed is a big question mark, and whether or not there would be lawsuits as a result of this requirement is also a big question mark. We know the last time the state of Wisconsin tried to institute drug testing in its FoodShare program back in 2015, it did go to court, and the court threw out the drug testing requirement at that time. You could read the Department of Health Services rule. You could also read their press release and let us know what you think. You can send us an email, you can send us a question, and you can join the conversation at healthwatchwisconsin.org. Thanks for joining us.